Alrighty, good morning. My name is Hannah Vietkus, and I'm a student at the University of South Florida, Sarasota, Manatee. I would like to welcome everyone to the Women in Leadership and Philanthropy 2015 Symposium, and thank you for joining our Chart Your Course to Good Health. I'm honored to be able to introduce our moderator, Dr. Carmella Sebastian, but before I do, I would like to tell you a little bit about myself and my experience as a USF WLP scholarship recipient. I am currently a senior at the University of South Florida, Sarasota, Manatee, majoring in psychology with a minor in leadership. I came to USFSM from London, England, where I attended an international school for the duration of my high school years. It was there in England that I discovered the field of psychology under the guidance of some excellent professors and mentors. I was immediately drawn to this field, as I felt it had the potential to enable me to follow my true passion in life, serving other people in a constructive way, especially to those in need, and providing a hand or a comforting shoulder to lean on. Albert Einstein is often quoted with his primary discipline of physics and mathematics, but he also had a strong opinion about the purpose of one's life here on earth. To this question, he responded, "To serve others, this is our purpose." I believe that my pursuit of psychology will help me to better serve others and help others understand themselves and the world around them in order to live a happier and more fulfilling life. I embraced Einstein's maximum to serve others, and I had to find a school that would not only provide me with the education to get my degree, but would also push me to be a better person and leader. I always wanted to go to school in Florida ever since I was little. I have lots of family here. And USF proved to be one of the most fast-growing, innovative, and exciting universities. I was looking for something small and intimate, but also with the benefits of a large university system. USFSM proved to be that perfect place for me. With graduation quickly approaching in May, I am thrilled and feel very prepared to enter the professional world, thanks to my experience at USFSM and the formal and informal education I have received from so many talented professors and mentors. I hope that one day I too will be able to give back to USF by assisting young, high-potential women with their pursuit of higher education and their life goals. I am humbled and grateful to be a scholarship recipient of the WLP for USF. Now I would like to introduce our moderator, Dr. Carmella Sebastian. Dr. Carm is recently promoted to Vice President of Medical Affairs at Florida Blue, as well as the President at Dr. Carm LLC. Dr. Carm is widely admired for her straightforward talk and sense of humor, and for offering all in her audience practical, achievable wellness strategies and the solutions, and we are thrilled to have her serving as our moderator today. Please join me in welcoming Dr. Carm to the stage.
Thank you, and I just want to say that at no time during my education in college or even in medical school could I have gotten up and done that, and done it so flawlessly, right? I mean, really, we have tremendous students here today. So I am so thrilled to be here, and I have to say, you know, I did this 2 years ago, and we had a hoot. It was great. And so today I came in and I said, gee, you know, I'll probably need something to wet my whistle a little bit, and they hand me this. I don't know what they're trying to say. I'm like this naturally. I don't really need alcohol. But you know, as one of the sponsors, Florida Blue wanted me to make a couple of comments, and I will. You can't script me, so it's really difficult. But I will say some of the things that they scripted, and then I'll put in my own 2 cents. And I just want to say that we've been around for 70 years, Florida Blue. I know we look terrific. And we have really devoted ourselves. And I have to say, I've been with the company for 6 years now, and I would not leave. They would have to remove me with the jaws of life, because they really live the value of making communities healthier and achieving better health. And so I truly, truly believe that, and they live it. We live it every day. You know that we have our very innovative blue centers. We have one right down on West Shore, and I want to invite everyone to come in. We actually, something that people don't know is we have 18 of them around the state, And in 11 of them that we call our flagships, we have nurses and nurse practitioners. So we take care of everyone. You don't even have to have Florida Blue. Like, you have United, come in. We'd love to take care of you. By the time you leave, you have Florida Blue. But I would be completely remiss if I did not echo what our magnificent moderator this morning in this room said, and that is that it is Breast Cancer Awareness Month. And so, you were very kind and said it in a very gentle way that you wanted to encourage everyone, and I want you to go get your mammograms. I'm not saying it in a nice way. You have to get out there, get your mammograms. We save life every day. Years ago when I was going through medical school, breast cancer was a death sentence, or you ended up completely mutilated, right? That doesn't happen anymore because we have wonderful ways to get the cancer when it's very, very small. And I would also say that every year there's controversy. Well, there's OBGYN sitting here looking at me now, so if I say something wrong, she'll kick me or something. Every year there's controversy that comes out that says, should we be mammogramming? Shouldn't we be mammogramming? Should we do self-breast exams? And someone told me that at a talk a while back, I said some comment about, you really need to know your vagina. I don't remember that. But I believe I probably said it because I do believe it. But you know what? Even more than your vagina, you need to know your breasts, right? We are our best doctors. Always remember that. Now for some of the more boring stuff. No. So what I want to start with was, I could go down and I could introduce each of these wonderful, amazing women to my right, and it would take a good half hour to go through everything. And I know if they introduce themselves, they won't be quite so verbose. So I think that what we'll do is we told them each to just give a little bit about themselves so you know where they're coming from in their careers. And then we're going to get into some really good questions. And I promise you we're going to leave time. So keep your questions, make your little notes or whatever. And what we're talking about here today is being healthy, and for many purposes, but one of the purposes I like to talk about too, and I'm getting more into, is the science behind the fact that healthier people tend to be more successful in their careers. And I think that's really interesting. There's a lot of science behind it. We'll probably talk about it in a little while. But let's just start with some introductions. So, Amy, can you start?
I would be glad to. Can you hear me through that? So my name's Amy Ruth. I am the Senior Vice President of the Human Services Group at Florida Blue. They gave me a prop earlier. It's somebody's job. I'm keeping my eye on you, Carmella. I had to pull it out once, but I let it go. So I've had this position and opportunity since February when we went through a leadership change in HR. And I was sort of one of the rare people that got pulled from the department and elevated to the senior executive status within the company. So it's been a bit of a year for me and a bit of a journey, and I'm really, really pleased to be here with you guys today.
Thank you. Dr. Parker?
Good morning. My name is Glenda Parker, and I am an internal medicine physician or primary care provider with Florida Hospital in Carrollwood. I've been in Tampa for about 6 years, and I moved here with my husband and my, at the time, 1.5 children. Now I have 3, and I'm very excited to be here.
Hi, I'm Kathy Lynch, and I'd first like to say that it's really scary to think that your daughter's in the audience.
She is. She is in the audience, but she's heard me.
And you have a boss keeping an eye on you, and you still come up with some of these things.
I am so courageous and a little drunk.
So I'm Associate Vice President for Faculty Development and Women's Health at USF Health, and I'm also the Medical Director of Inpatient Obstetrics at Tampa General Hospital, where I've been on staff for 20 years. I'm married to a fellow who's sort of busy at times. and you can, I believe, hashtag him is what we're doing. We're tweeting out.
We're going to tweet and hash. That's why Ange is here. Yeah.
So you can hashtag my husband at Bob Buckhorn.
Bob Buckhorn.
Mayor.com or whatever you want to.
Dr. Lynch's husband.
Yes.
Yeah.
Yes. He does enjoy going to meetings where I'm there at the meeting, and he says, I'm just Mr. Dr. Lynch today. So we have 2 daughters, and your daughters are at a wonderful age. Wait till 14 comes. So my oldest is 14, and she gave me a loving glare this morning, and my little one my 10-year-old gave me a kiss. So I think I've said enough.
I think that's great. Yeah. One of the things is when we had our pre-meeting, Amy couldn't be on the call with us, but we quickly found out that Dr. Lynch has 2 daughters. You have 3, and I have 2. And for that, we should be getting raises. I mean, right off the bat. But no, we love our little girls, and we can dress them up, and then they get to be teenagers, and we send them over to the neighbor's house. So one of the things that we
That's
wanted
why it
to
takes a village.
Yes, it does take a village. It does. One of the things we were talking about, we touched on a little bit if you were in the session this morning in this room, was balance, leaning in, can you have it all? One of the things that I've noticed in myself, as well as friends, family, patients, is that when we try to do it all, at some point, sometimes something gives. And more than not, it can be our health. And so what we wanted to talk about first was there a time in each of your lives when your balance was a little bit off and it affected your health, and how did you fix it? So let's start with Dr. Lynch.
Well, I thought about this long and hard, and I thought, when was I off balance? And then I realized I had a time where I was literally off balance. And my husband and I had gone out for dinner on a Saturday evening in July. So what would happen on a Saturday evening in July? An afternoon thunderstorm. And as we were walking out of the restaurant, I was walking quickly to get to the car because it was still drizzling, and one foot planted and the other one didn't. And I went down and said, ooh, I think I just twisted my ankle. And, Bob helped me up, and we got in the car, and he said, do you want me to take you to the ER? And I said, honey, I just twisted my ankle. It's really no big deal, but it really does sort of smart. And so long story short, we get to decide that since it's Saturday night and it's still early, let's go to the ER and get it checked out. And sure enough, I had a spiral fracture of my right ankle. And but of course, I was scheduled to work on Monday. And so I did what anybody who was non-weight bearing on crutches would do. I showed up, and I notified the chairman at the time. I said, I might need some help in the office seeing patients today because I can barely maneuver in and out of the room. So maybe kind of keep my schedule light, but I still showed up, and I found it very much of a challenge to try and get around on crutches. But and if you put your foot down, you really realized that was a bad idea. So I, but realized that I needed to be there at work, right? I mean, they need me. Why should I take time to take care of my health? I'm a necessary part. And later in the week, my daughter and I were going to meet family for a vacation, and so I did what anybody sane would do. I sent the nanny out to get one of those kid leashes, right? Because how am I supposed to go to the airport with a 2-year-old who wants to run around the place, and I can't, I'm on crutches. I can't maneuver. So you get some really great looks when you're holding your child, and they don't see your crutches and see that you're wobbly. So 12 weeks of all this, and at the end of it, the orthopedist said, well, in general, we recommend physical therapy, but you're pretty active, and I don't know if you want to take the time to do that. So, but if you want physical therapy, you can. I said, I can do the exercises at home. So to this day, I don't really have full range of movement in my right ankle, and it clicks at great times, and ultimately from having to continue to needlessly push through all this, I ended up having to have surgery on that foot for a neuroma that developed from the persistent swelling. So if you're off balance in that direction, put your feet up would be my take-home point. Take care of your health. Take care of your health.
You're an awesome doctor, but a pretty lousy patient.
I'm a terrible patient.
Yeah. And I think, listen, I signed out AMA once.
Yeah.
I didn't like the fact that the surgeon was coming around at 12 midnight. I thought that was inappropriate, so I decided to sign myself out. I've done lots of things. Oh, I had drains once. Do you know what the drain is? It's like the plastic tube that goes into your body and drains all the stuff. Well, I was walking into CVS. I probably shouldn't have been out at that time after my surgery. And CVS never asked me back after that, even though I used to spend a lot of money there, because one of the drains started edging out a little bit. And so I had these drops behind. It was disgusting. But that's not the point. The point is that after I drove myself home, I thought, what the heck is this? These drains really need to come out now. Now, should I go in and have this surgery? No. So the husband is there like this, what are you doing? I said, shut up and hold the ball at the end of it because I'm cutting this out of myself. Now, I don't suggest that anybody do that. It was all right. Everything was fine. The surgeon yelled at me, got him, made him feel like a man or whatever. But the point is that we don't really take care of ourselves, and we do things to ourselves we wouldn't ever want someone else to do. And I always think to myself, sometimes I say stuff to myself that I would never say to my worst enemy in my mind, right? Like this morning, I was all about the fact that I have some back fat. I have back cleavage because when you put 3 pairs of Spanx on, it pushes, right? We're not nice to ourselves.
3 pairs of Spanx might increase your risk of pelvic organ prolapse. Just saying.
I'm going to the ladies' room right after this. You're up. Blazer. The back. Oh. Yeah. So I do have back fat. Thank you. What a friend.
You look lovely in that dress.
Do you want the eyeball?
So tell us, Glenda, when did you slip and fall a little bit and get yourself back up?
So I was talking about this with my husband last night, and it was really hard for me to pick just one. Mm-hmm. So we mentioned I have 3 girls. I have an 8-year-old, a 6-year-old, and a 3-year-old. So I feel like I'm off balance every day, right? Every day. So one of the times that I noticed that I felt more off balance was when I went back to work after having my 3rd child. And she's a newborn at home, and I'm at work working the long days, and I noticed that a pattern was starting to develop. I would come home 6:30, it's a good time to be home, and my husband, who's a radiologist, he works nights, he would be getting up from his rest, and there was no plan for dinner. So we were starting to eat out more, and not only just eating out, like going to takeout restaurants, but also going through drive-thrus. And I tell my patients all the time when we're talking about healthy eating and healthy living, don't go to drive-thrus, just avoid them. And it got to the point where my children would be the first children to have the complete set of McDonald's figurine toys when the new toys would come out, repeatedly. And my little one, who, not the baby, but the 2-year-old, she had this song where she would sing, French fries, French fries, and she gave me a ceramic figurine of a McDonald's French fry as a present. So it was way too much. So I had to make a conscious effort and decision to plan to eat healthily. And I was shocked to find out that It's much easier to steam vegetables in the microwave than it is to worry about getting French fries. It is so easy to make double portions and put something in the freezer when I do cook. I can hit the on button on the crock pot, and when I come home, dinner is done. And I'm proud to say that my third child, who's now 3, she eats far more broccoli than anything else, and there's no drive-thrus in the house.
That's wonderful.
In our
That's
household.
wonderful.
Yes.
And, you know, we should all remember that eating out, even if it's at the best restaurant, and last night Amy and I went to Seasons 52, and you always have. I've never, again, I have to say, I have never had a bad meal there. And they show you the calories, and, you know, they give you these portions that are real but anywhere you eat out, you have to know that you are getting 2 times the amount of salt, fat, and sugar. No matter where you eat out. And portion extortion has taken over our lives. So it's such a wonderful, easy thing to do, to plan. The other thing I always try to do, but I don't do it all the time, is Sunday night, you know, or
Yes.
whatever night of the week that you're sort of at a lull, just churn it out, you know, and
Absolutely, and I forgot to mention, so I am one of the 70 million Americans in this country who have high blood pressure. So it's even more important, I think, for me to set a good example for those 3 young girls to eat healthily. So, yes, learned the hard way. We got rid of all those McDonald's toys and doing a much better job.
very good, very good. So, Amy, I know you have something to tell us about this.
My turn. So there I was working in a subsidiary company of Florida Blue, had moved to Florida from Atlanta for about 2 years and was trying to prove myself, trying to make a name for myself in a new community, new town, new focus in my career, and found myself waking up one morning and couldn't really move, and realized after having gone to the emergency center that I was suffering from a case of diverticulitis. Well, that's a pretty categorical failure of your diet, what I came to learn. It wasn't actually genetics, it was just that I was cheating myself every single day for how I was living my life. So there I was trying to figure out why in my middle 40s I was dealing with something like that. So for me, that was about constantly being on the run, constantly eating just the worst possible diet that you could eat, and having to sort of retrain myself and learn. And unfortunately, it wasn't the first time I got diverticulitis that it sunk in. It was the second time I got it. And you don't want to have that more than once if you can help it, because it's bad news.
That's because the doctor said what to you the second time? The doctor said,
Eat a salad part?
well, he said eat a salad.
He thought the second time I had it, he thought I had colitis and that I had actually ruptured my
Scared the crap out of you.
Scared the absolute crap out of me.
Literally.
You don't get to do that every day. So yeah, no, he thought the second time I had it, he thought I actually had ruptured everything on the inside.
So he told her eat a salad every day, and you've been very, very religious about that.
I try to do that I used to, prior to that, I probably ate a salad maybe once every other month or so.
Yeah.
And it's the simple things that you can do that actually are a sign of taking care of yourself, that when we get busy and as our careers take off and our families start to grow and it becomes more complicated, that you let all that go. And that's really when you got to double down and make sure you take care of that.
See, we know something's happening in this country because our bowels are telling us. So let me explain that. So chronic stress has an effect on every part of your body. But when I think back about my training in the 80s and the early 90s, we did not study. I mean, people came into the hospital, and it was kind of unusual. They came in because they had really, really bad colitis and, you know, maybe some diverticulitis. We didn't see it all the time. But let me tell you what, everybody today has some form of irritable bowel syndrome or another. We're all on probiotics, and we are all in the yogurt section doing what Jamie Lee Curtis tells us to do so that we can poop the next day. Right? I mean, there's something to that. There's a lot of stress and there's a lot of fast food. And I think when you put those two things together, you have issues. So I think that that is a really good example. Thank you. So let's talk about some of the things we see manifest as chronic stress, as being off balance. And so, Dr. Lynch, I'm going to start with you. What do you see patients coming into your office? What is seen more often?
Well, I typically get patients coming in saying that their husband had them come in to ask me if they were in the menopause, or were their hormones out of whack. And when I start to inquire why are they asking those questions, and why is it that their husband thinks they're in the menopause, maybe they're a little bit more cranky, a little more testy. The PMS is a little bit more pronounced, and it's throughout the whole month. And then I typically ask, well, so when's the last time your husband did the dishes? When's the last time your husband helped put get the children to have a bath and get them to bed? When's the last time your husband made lunches for school the next day? And maybe you have a reason to be testy, cranky, perhaps not interested in sex, because you're tired. So I think those are oftentimes a sign. The other would be I've gained this weight and I can't seem to get rid of it, and then you start to question and you find out about the drive-thrus. Mm-hmm. And so when are you actually sitting down and having a family dinner? Which is probably, there's data that shows that one of the best things you can do to help your child prepare for the future is to actually have family dinners, where instead of them Snapchatting with their friends somewhere else, they're actually having to talk at the table. Now, admittedly, my 14-year-old doesn't necessarily always talk at the table, or what she wants to talk about may not be in the tone or how we want to talk, but on occasion, you can actually get a decent conversation out of your child, and they at least learn some good behavioral skills.
Somebody was telling me, I can't remember who it was, but they have this tradition at their dinner table where they have a bucket or a hat, and everybody has to put the phones in the bucket or the hat before dinner starts. And I think that that's a beautiful thing, because, I'm even guilty of it, especially after my promotion of 2 weeks. I'm trying to be such a good Florida Blue employee.
She's just saying that because I'm sitting
yes,
here.
Yes, that's true. That's true. But, and so even I will pick it up, and bad me, right? Bad daddy doing whatever he does on, the cell phone. So yeah, I think it's wonderful to be able to sit around and talk and be able to eat slowly and not. I knew my life was off balance. This is an honest to God true story. I knew my life was off balance when the kids were very young, and we went, and I was taking them, I remember, to catechism or something, and we were coming from some kind of, and we're driving through, and I said, well, let's get something to eat. So we were driving through Wendy's, and we go through the drive-through, and they said, well, aren't we going in? And I said, no, we don't have time to go in. Like, we didn't have time to go into Wendy's. We sat in the car in a parking spot outside Wendy's after going through the drive-through. That is my definition of a failure as a mother. What's wrong with me, right? So, Dr. Parker, what do you see in your patients?
Well, as a primary care provider, I feel like I see a lot of hypertension or pre-hypertension, diabetes or pre-diabetes, and I think both of those are related to obesity. And so my patients find that they've slowly put on maybe 5, 10 pounds every year for the last 10, 15 years. And the next thing they know, they're 50 pounds heavier than what they would like to be. And then it seems like there's common themes here. Mm-hmm. We start thinking about and talking about lifestyles and behaviors, and it turns out they are stressed out to the max, managing their careers and their aging parents, their young children, and the next thing you know, they've put on the weight and they have these chronic medical conditions now. So we spend a lot of time talking about lifestyle modifications, and I share with them my own personal tips that I've been learning as far as how to eat healthier and how to work and exercise into our daily lives. So I can't tell you the last time I went to the gym, but I very recently scored 4th place in the family on Xbox One Just Dance.
Wait, that's 4 out of 5,
yeah,
and
that-
once and
That's actually a little sad.
Not last
but
place.
yes, the 3-year-old, she'll catch up to me in about 1 more year. So it was a lot of fun, though. So,
But you know, we
yeah.
talked about, on our pre-call, we talked about what they're now terming unintentional exercise. Also kind of known as activities of daily living, we used to call it. But doing things that don't particularly involve a very expensive membership at a gym, gardening, walking, parking further away from the door, walking up steps instead of taking the elevator. All of these things count. And I think there's been debate over the years, you know, oh, you have to sweat, you have to get your heart rate up. That's terrific if you have the time to do that. But if you can squeeze just a couple of minutes at a time and work out, it's a wonderful
I
thing.
broke a sweat, a lot of
Did you
sweat.
on the
Yeah.
Xbox?
Yeah.
Yeah.
Is that sad or good?
I don't know that you should really talk about that.
you
but
know
Yes.
the Wii Fit also has some pretty good stuff.
It
I mean,
does,
I have
yeah.
been sore after doing the some of the exercise on Wii Fit.
I have their Zumba. It's pretty good.
Yeah.
Yeah. So, no, trying to do things like that, rebounding for the kids when they play basketball, telling my patients park further in the parking lot, take the stairs instead of the elevator. It's been
Good.
good.
Good. Amy?
I'll come at this a little bit different since I'm not in the medical field. When I think about women that I've counseled and coached through their careers, oftentimes when you start to see some of this come into play is when you see an attitude go down the drain. So you see someone who's otherwise engaged suddenly become negative, and everybody around them stupid, and everyone around them is doing it wrong, and they just don't understand why they don't want to do it my way. And you can really see a lot play out in your attitude, and so much of your outlook on life has to do with how your entire life is in balance and how you're coming at it. So as you think about your careers and your professional life, it's really important that you maintain that sense of positive energy, because so much of this at its root is energy, and whether or not you're going to focus on a positive attitude or a negative attitude, you'll really bring a lot more in your career with a positive attitude.
You know, we were talking as we're going through, and we're looking for common themes. One of the themes that I keep hearing again and again, although it might not be explicitly spoken, is respite, recovery. And that's one of the things, when we get very, very busy and we get very stressed, things start to happen. In fact, people who have chronic stress have 50% more accidents than everybody else. So I mean that, you know, it's not unusual. I hope you never fall in front of the wheat. But, you know, so we need to have recovery. And I started thinking about, you know, these books that you read throughout your life, and, you know, they're the leadership and the self improvement books. And for some reason, I must have read 7 Habits from Stephen Covey years and years ago, because all of a sudden it sort of popped in my brain. So this morning I'm on there and I'm like, I don't remember what the 7 habits are. I probably should look it up. And I was thinking, I wonder if he was smart enough to capture the idea of recovery and taking time for yourself. And in fact, the first habit is be proactive. The second one is begin with the end in mind. The third is put first things first. The fourth is think win-win. The fifth is seek first to understand. By the time I got to 6, I was like, maybe Stephen ain't so smart at all. But the 6th one was synergize. I get to the 7th one, and it's sharpen the saw. And I always thought it was, you know, go back to school, go do something to improve your mental capacity, or no. What it is it means persevering and enhancing the greatest asset, preserving and enhancing the greatest asset you have, you. It means having a balanced program for self-renewal in the 4 areas of your life: physical, social, emotional, mental, and spiritual. And then he gives examples of them. So even all those years ago, the 70s, when the book first came out, they said, you know, we really need to take time for ourselves. Now I know I'm getting to this, which means that Kathy is either dancing in the back or I have a couple minutes to wrap up. And we want there, now she's giving me the wave, okay. You're all just such fun, you know? That's why I like doing this. I have a couple more questions, but I'm going to save them. I'm going to go to the audience, and you know, if you all guys all get shy or you run out of questions, then I have other things to ask our wonderful women up here. So let's take some questions from the audience. Anybody have any questions? Yes, ma'am. Wait till the, where is our, does anyone have the, we need that. There you go. You see that? Teamwork. Yes.
You talked about good health and nutrition and everything that you might do on a daily basis. What do you do for yourself to take time to self-indulge or self-soothe that's just for yourself?
Right here, baby.
That was going to be my answer,
Number
too.
2.
I'm joking.
Well, I try and go swimming about 3 to 4 mornings a week, and fortunately, my husband does do morning duty, and so it's a really big problem when he goes out of town. But it dawned on me a couple years back that, you know, trying to do something late in the day was just not going to work. You know, it's so easy to say I can't do it, and so a friend and I started to say, okay, well, let's go Thursday morning. I'll pick you up at 10 to 6, and we'll go swim. Which, it's key to make sure you, especially starting out, that you phone a friend. Because it's really hard to call them at 5:45 and say, I know you're up and you're ready to go, but I'm tired and I'm going to roll over. So Catholic guilt, big on that. So use what you have to do. So I try and take the opportunity since he's does the morning, that I can go and just have that time for myself, and miss some of the mayhem of the morning routine, and come back home and they're pretty much getting ready to go out of the house, and I then sit and read the paper and have a cup of coffee.
Mm-hmm. Thank you.
I like aromatherapy. So essential oils, I have this little box with the little things, and then there's a fragrance for every mood. So if I'm stressed, I can put one on my little pulse point here or here, and take an inhale, and it feels so good. So that's my little self-indulgence that I don't know the science behind it at all, and I pride myself on evidence-based medicine, but I like it.
One of the things I would just offer is that you probably slow down because you have a pattern of putting the air and then you breathe deeper, and so it's probably a form of meditation in one way or another, and that's wonderful.
It works.
Yeah, it works.
I've got the chlorine aromatherapy going on my skin right now.
How's that working for you?
That's good.
So mine is a little bit different because this year the piece that I've had to focus on is sleep, because the part I missed was exercise. So I'm in the process of trying to get exercise back. I've frankly gained about 15 pounds this year with this new position and opportunity. My life is very different than it was a year ago. So trying to really kickstart myself back into some of that. When things get really tough for me, I live about a block off the Atlantic Ocean, and so I will go and take a walk on the beach. I don't do that enough. But that for me is, I love both the beach and the mountains, and you don't get the mountains in Jacksonville, Florida. So I try to go take a long walk on the beach, and have my talk with God.
I have sex, but nobody wants it. Next question.
What would be some of your trusted websites that we could go to get truth about health? I mean,
That's a great
being
question.
menopausal, it's like, do you go on the pills? Do you not go on the pills? Do you this? And some of the younger women, coming up with some of the new discoveries about sugars and gluten and that. So what would be some of your trusted websites?
Why don't you take that one, yeah?
Okay.
'Cause you were going to talk.
So I have a website I want you to all remember. If you know anyone who doesn't have pharmacy coverage, or maybe they have Medicare Part D and they're in the gap, goodrx.com. And I love this website because you can put in your zip code and the drug that you need, and it will give you a list of the pharmacies and what they're charging for the medicines. So you can comparison shop, and then they often have coupons for the drug. So that's one of my favorite websites. For supplemental things, herbs, vitamins, those kinds of things, I go to the Department of Health, and then I type in, they have a website for complementary and alternative medicine, so I look at that website, and you can find information on drug interactions, whether or not it's safe, quote unquote. That's another topic in itself. And then just for general medical advice, I encourage my patients not to use Google and to talk with me as their primary care provider if they have questions. But if you really just have to look at something on the internet, the Mayo Clinic has a pretty decent, not pretty decent, a good summary of many different health topics. So I like their website. And then since we're talking about technology, I wanted to say out that there's an app for everything. And I've found that using apps really help. We're using smartphones so much in this day and age. One of my patients asked me to be her MyFitnessPal, which was great because there's a pedometer on the iPhone 6, so you can put in your steps. There's a way to track how much calories that you're taking in. So if you're wanting to know how much calories are in my Starbucks pumpkin spice Frappuccino, you can look at that. And if you don't want to know, don't look at it. But there's so many good apps that are out there that can help you with just about everything.
There's a My Period app, I think, and
Wow.
Yep.
Great, thank you so much. Any other questions from the audience? Yes,
I
ma'am.
just had a question. I do try to eat healthy and salads, and I did lose a lot of weight, but I find that as I eat a lot of raw vegetables, I could eat a salad, it really actually makes me sick. I like eating them, but it seems like my body doesn't digest raw vegetables well. Do you have any suggestions on how I can, kind of incorporate the healthy diet with, that balance?
Yeah, that's tough. I find that the healthier I eat, the more gassy I am. Yeah, those raw vegetables, they're great and they're healthy. They're giving you the fiber, but they also make not just you, but everybody flatulent. So they do have some supplements over the counter, and some of my patients it works, some of them it doesn't. The Beano types of supplements, probiotics sometimes can help. I don't know what your age is, but if you're having regular colonoscopies, that can give you some peace of mind that everything's okay if you're in that age group that needs it.
I tried Beano. Beano never worked for me, but I'll tell you what, probiotic, we were talking about it last night at dinner, I don't know why, but probiotic, do you use a probiotic? You should think about that. I was kind of like, especially where it says on the box, 7 million different type of bacteria. It's kind of like, oh, do I really want to put that? But it actually works. And I think around the time of perimenopause, we tend to have more GI issues. I'm just noticing. Well, everything in my body's gone amok, but okay. Any other questions? Yes, ma'am.
Hi. So I have 2 small children, 5 and 2, and my job is pretty much I get to work and I hit the ground running. My husband works in hotel running banquets and restaurants, so I pretty much am like a single mom most of the time. And so I have this guilt because I have a gym membership, but as soon as we get home, it's reading books for kindergarten, practicing your words, all these different things. And so most of the time, I guilt myself all of the time, I guilt myself into never making it to the gym because I feel like I never see my children because we're just so busy. And on another note, I actually just started a recipe program at work where if you have like a good fast, that's the main fast recipe that's easy for a lot of working moms, we just put put them in the break room and exchange them, and if it's good, you try it out. But for that gym guilt.
Okay, first of all, no more guilt. That's a very negative thing to do to yourself. And let me tell you what, so my daughter's sitting there, she's 18 and dreading the fact that she ever came today. And the 21-year-old is off somewhere, right? We all have, if I had that guilt from the time they were young, I would be probably in an institution right now. You will make yourself sick with that. You are doing a fabulous job, and every morning you should get up and tell yourself what a fabulous job you're doing. And you know what? The fact is that I was the same way in the beginning, and I would drive from my first job when they were young, and I would be getting to the point where I'd be passing the gym. And at that time, Nike came out with this, it came and it went. It was a marketing advertisement, and it said, there's 24 hours in a day, this one is yours. And I literally did a mantra. And I would be driving past going, this one is mine, this one is mine. And I would feel very guilty. I knew they were in good hands, or they actually, most gyms now have a little nursery where you could take them in and stuff. They'll be fine. And guess what? There will come a day, I swear to God, when yours will do what mine did to me. So at the ripe old age of 43, they started looking over and going like this, gobble, gobble, gobble. Okay? Just keep that in your mind. They're going to do that to you someday. They're going to say your butt's too big, or your boobs are down at your waist, or they're going to make some fun of you. And then they're going to make some 3-4 years when they're teenagers, and you're going to absolutely want to pull your hair out. Exercise now so you don't kill them then. Okay? Exercise. Go do it, and don't do no guilt.
Well, and the other thing you want to be thinking about is, what is the example you want to set for them?
Yes.
Okay?
Nice.
So, yes, the hour is yours and you should take it, but you also want to be able for them to say, okay, I'm living a good example for my children.
Yes.
So it's not about the quantity of time, it's about the quality of time and setting the right example. So, take that time, as you're passing the gym, or perhaps it's, maybe starting the day a little bit earlier and getting them to where they need to be, for their care during the day a little earlier, so that you have that time. But make sure that they're part of it. And then in that recipe game, which I think that's a brilliant idea, involve them. Make it the kindergarten math project. It says it's calling for a quarter of a cup. This is a quarter of a cup. Kindergarten's they're not going to get what a quarter is, but get them involved. I mean, cooking is chemistry. Mm-hmm. So when they start to freak out in chemistry in high school, you can say, all that time we've cooked, that's all chemistry. So use it that way.
That's wonderful.
The other thing I might add is, how many of you in the room today are professional women who work? How many of you have paid time off? Keep your hands up. How many of you use paid time off for just yourself?
Good for you guys.
Good
who have
for
your
you.
Hand up. That is
Because you have paid time off, and we decide that that's for everybody else. And that's for the group, that's not for the individual. I would encourage you to start thinking about periodic, call them mental health days, call them maybe a deeper dive into exercise something, but give yourself a chance to take full advantage of what's available to you where you work. There's lots of resources through where you work as well that can make a big difference in your day-to-day life.
Now, you know what, we're gonna stop questions here for a second, but come up to us because we'll hang out after. But what I want to do is I want to send you away with what I call my Technetium 99. So when I'm in medical school, one of the people comes in, and the teachers, and they're a radiologist, and they said, none of you will ever be radiologists, but you're going to have to pass the boards. So in order to pass the board, you're going to have to answer a couple questions correctly. And I'm going to teach you a whole bunch of stuff today. You're not going to remember anything, but remember this, Technetium 99. That's going to be the answer to the question on the boards. So all I kept saying to myself was, I must talk to myself a lot, Technetium 99, Technetium 99. Went out, and sure enough, that was the answer to the question. So what I think is we take away very little sometimes of what we hear. And I want to just have one parting You know, wow. The last session we had, what would you tell your younger self? So maybe one tip that you would say to a best friend or a sister that you actually like, or someone that you really appreciate, what would you say to them that you might not even say to yourself, that you would be like a health tip that would get them more in balance? Let's start with you, Dr. Lynch.
As I mentioned before, phone a friend. So use your friends. Use them to help get you back into the exercise routine if you're not doing it. Use them to get you to say, hey, listen, our girls are now old enough. How about we go play golf on a Sunday afternoon? Thank you, Becky, for taking care of the girls. And realize that, or use your friend to say, can you take my kids for a few hours so that I can go do XYZ and have my own time? And I'll, reciprocate as well. So phone a friend.
Mm-hmm. Very good. Glenda?
I'd say, excuse me, it's a lifestyle and not just a quick diet or quick fix, but just slowly incorporating meaningful change that you can maintain. And yeah.
Believe you're worth it.
Yeah, that's a good one. And if you're wondering, you are all worth it. So, and here's someone else who's worth it. Hannah, would you come up again? Hannah's going to send us off into lunch. And so I just want to thank you. You've been terrific, wonderful. I think we really appreciate what great wisdom came from this stage today to my right. And let's give them a round of applause.